One of the important questions to ask when we're discussing healthcare reform is what structural changes need to be made to have our system be more effective and efficient. And some of them are included already in the Affordable Care Act, which is now beginning to go into effect. Certainly we need to have everybody in America in the system. Everyone needs to be covered with health insurance so that we have a large risk pool that includes everyone. And so that when the uninsured person incurs a large health care cost, they're part of the system too. Secondly, we have to have a system, and we will have it in 2 more years, where there are no denials for pre-existing conditions. And that has been really important for so many people who are unable to get affordable health care because they have an illness. So additionally, I think one of the important things we haven't addressed in the Affordable Care Act is the reduction in administrative overhead in insurance companies. In a for-profit insurance company, about 30% of their revenue goes toward administrative overhead, which is quite a bit more than in any other kind of healthcare system. In Medicare, for example, that administrative overhead is only 5%. And in the Canadian healthcare system, their administrative overhead is 3%. So this brings me to a recommendation that perhaps the American system should be like Switzerland, France, and Germany, where there are no for-profit health insurance companies. They still have all private health insurers. They compete with one another. They do very well. None of their executives make exorbitant billion-dollar salaries, but they make a good living and they're able to compete on quality and quickness of response and services that they're able to offer to the covered patients. So if we were to have a system like that in America, we would save billions of dollars every year on unnecessary administrative overhead that could go directly toward patient care. I wrote a book called Be the Change: Transforming Healthcare from the Inside Out. It's about this topic and many more. If you'd like a free chapter of my book, go to www.bethechangehealthcare.com and I'll send you an email with a link so that you can download this chapter. Thank you very much and have a great day.